2, James Evans.
And I move the amendments tabled in the name of Paul Davis. And I'd like to thank Plaid Cymru for the debate today and for taking a lot of the ideas from our last manifesto. I'm very pleased that you're already looking at what we can do. Before diving into the challenges we face, I want to extend my deepest gratitude to the incredible NHS staff right the way across our nation. However, despite their unwavering commitment, our NHS staff are being let down by a government that is failing to provide the support and leadership that they need. The First Minister and her government, along with the Cabinet Secretary, are presiding over a health service in crisis. As of January 2024, over 700,000 patient pathways were waiting to start treatment, with more than 23,000 people waiting over 2 years for treatment. These are not just numbers. It represents thousands of individuals enduring prolonged suffering due to systematic failures. In October 2024, only 50.4% of life-threatening emergency calls received a response within 8 minutes, well below acceptable standards. A recent poll indicates that only 24% of people in Wales are satisfied with Welsh NHS services, reflecting a significant decline in public confidence. Overcrowding in hospitals has become the norm. More than 1,600 adults are occupying hospital beds despite being clinically optimised for discharge, and 15% of beds are estimated to be taken up by patients who no longer need to be there. This isn't just inefficiency, it's a symptom of a deeper problem and the chronic underfunding and neglect of our social care system. A robust and well-funded social care system is essential to ensure patients can be safely discharged from hospital, freeing up capacity for those in need. Yet this government has consistently failed to invest in the integrated care system that Wales desperately needs. The government has celebrated that it pays social workers the real living wage, where in reality, those social workers doing a fantastic job could earn more money stacking shelves. The time for excuses is over. It's clear the First Minister and her government are failing Wales. Labour's approach to our NHS has been categorised by a complacency and a lack of ambition, leaving patients and staff across Wales to pay the price. The First Minister promised to eliminate long waits, yet the situation has deteriorated. The new Cabinet Secretary for Health has promised that he'd take an opportunity to take bold action, but since taking post, he has barely tinkered around the edges, failing to address the root cause of the crisis. Excuses have ranged from COVID to flu to unprecedented demand. These have been seen across the United Kingdom, but in the NHS in Wales, it is lacking direction. It's underperforming and has significantly worse outcomes than in England. Only the Welsh Conservatives have a vision and determination to fix the NHS. We have a clear plan to address the challenges facing our healthcare system. You all know what we're against in this chamber, so I'm going to tell you what we're for. We're for establishing centres of excellence, more surgical hubs and rapid diagnostic centres to reduce waiting times, expanding hospital bed capacity to ease overcrowding, as under this Labour government we've lost 4,227 beds from our hospitals, and that can't continue. We would implement a comprehensive workforce recruitment and retention strategy to support and retain our fantastic NHS staff. Without the staff, we have no bed capacity and people to treat patients. And we'd also secure the full Barnett consequential for the Welsh NHS. Too much money has been swallowed up by the NHS executive, bureaucracy and management, and we will spend that full Barnett consequential on the front line. We on these benches also would not see patients in Powys suffer, so we provide the necessary financial support to Powys Teaching Health Board to prevent further delays for cross-border treatment in England. Let me be clear, the NHS is broken and it needs to be repaired. So on these benches, we want to see a full and comprehensive review of the NHS in Wales, independent from government, so we can get the best NHS possible for the people of Wales. Our NHS staff do everything they can, but they cannot be expected to fix a system that has been broken by years of Labour mismanagement. Welsh Labour has failed to take bold steps needed to reform the system and support our hard-working healthcare professionals. This cannot continue. The future of the Welsh NHS depends on decisive leadership and a commitment to real reform, not tinkering around the edges. The passing the buck has to stop. Minister, you can't blame Westminster anymore, and this Labour government must take full responsibility for 26 years of mismanagement, poor leadership and shirking your responsibilities to the people of Wales. Only us on this side of the chamber can fix Wales. Only we can fix the NHS and deliver the changes that are needed to create a healthcare system that the people of Wales pay for and rightfully deserve.
Yeah.